This is Kumar. Today I'm going to talk about the little burglar who has taken the whole world on a ride. Yes, that's a coronavirus. A coronavirus is a generic term that includes a large family of viruses, similar to saying that someone has the flu. And the SARS-CoV-2 is a specific virus that can cause COVID-19, a disease. And as the WHO explains, this is similar to differentiating HIV and AIDS. And HIV is a virus that causes AIDS. So now today let's look at some of the facts about the coronaviruses. So first let's look at the transmission of this virus. The SARS-CoV-2 is the main mode of spreading from person to person is through respiratory droplets. That is the saliva and the mucus, which is carried in an air after an infected person coughs or sneezes. And these droplets can land in the mouth or nose or inhaled into the lungs of the nearby people within a diameter of 6 feet. And one of the fact of the transmission is it may be possible for a person to be infected by touching a surface that has the virus on it and then touching their own mouth, nose, or eyes. According to WHO, coronavirus may survive on a surface for just a few hours or several days. Although many factors will influence this, including surface material and the weather. So there was a study about the coronavirus, and that analysis of 22 study, it reveals that it persists on an inanimate surface like metals or glass or plastic for up to 9 days. And it may be efficiently inactivated by the surface disinfectants like ethanol, which can be about 60 to 70% or 0.5% of hydrogen peroxide or sodium hypochlorite within 1 minute. And now let's look at how infectious is SARS-CoV-2. It is the epidemiologist uses R naught to estimate how many other people one person is likely to infect when everyone in the population is vulnerable. And it depends upon 3 factors, which is infectious period, contact rate, and mode of transmission. So if the R naught of SARS-CoV-2 is between 1.4 to 4, which is quite high as compared to other infectious diseases like Ebola, H1N1, and measles, but lower than smallpox. What is the incubation period of COVID-19? So an incubation period is the time between being exposed to the virus and having the symptoms of the illness. The estimates suggest that symptoms of COVID-19 usually appear around 5 days on an average, but its incubation period may be as short as 2 days to as long as 14 days. And what are the symptoms? The symptoms are like common cold, and it can be respiratory tract infection or lower respiratory infection in which you can have a symptom like respiratory failure, in which you will be feeling like you can't breathe in enough air. And if the level of oxygen is very low, your skin and the lip and the fingernail can turn bluish. What are the recovery chances if you're suffering from COVID-19? Most of the people who get sick will recover from COVID-19. And there are 81% they recover from COVID-19. And the 14% are the severe cases, in which they include patients suffer from shortness of breath and they develop pneumonia. And 5% are the critical cases, which include patients who are suffered from respiratory failure, septic shock, and multiple organ dysfunction, and they may die from that. Let's compare the fatality rate of the seasonal flu and the COVID-19. So for seasonal flu is as low as 0.1%, and for COVID-19 is 2.3%, and in which the 60 plus year patient is suffering the most, which is the 6%. It's 7 times higher than the flu. How to prevent COVID-19? It's the best way is to clean your hands, wash it, and by social distancing. So you can flatten the curve by social distancing. What are the treatments? The prevention is the best option because there are no drugs which are being available for treating the COVID-19. Because it's so there is only supportive care, which means giving fluid medicine to reduce fever, and in severe cases, oxygen for supplemental support.